A midwife is a professional of allopathic medicine who specializes in the provision of maternal and infant healthcare services. While there are midwife and OBGYN services in Madagascar, most commonly used are traditional birth attendants, called Reninjaza. Because a large part of the Malagasy population does not have access to hospital services, they use these highly respected people, generally women, for their needs during pregnancy and birth. During my time spent in Madagascar, I was lucky enough to speak to some experts on Malagasy healthcare as well as a few Reninjaza. Reninjaza are highly respected in their communities and have a lot of experience attending and helping with births. However, they lack formal medical education and are often unaware of circumstances in which a woman should be brought to a hospital. Things like massaging the womb, administration of medicinal plants during labor, and the washing of newborns have the potential to be dangerous to the mother and the child. For one Reninjaza in the small rural town of Andasibe, these are facts that have been brought to her attention by a local hospital. This woman, at 90 years old, has been working as a Reninjaza since 1952. She only stopped very recently to hand down her gift to her daughter, who has since taken over. She also has a close relationship with a local hospital, something that I learned was uncommon for Reninjaza in Madagascar. If there are complications with any of her patients, she takes them to the hospital, which is about a 10-minute walk from her home on the edge of town. She uses no medication, but has learned the circumstances in which a pregnant woman may be in danger. The hospital often asks her for herbal remedies, and she even has a certificate from the Ministry of Health allowing her to practice. Most hospitals and healthcare centers I visited were untrusting of Reninjaza. While they respected the kind of work Reninjaza do, they believed it careless to deprive a pregnant woman of modern medical services. The hospital in Andasibe, however, worked closely with the Reninjaza I mentioned, and their positive relationship was the key to hundreds of healthy deliveries. If only the rest of the Reninjaza in Madagascar could be respected and acknowledged by modern medical personnel, this integration could help in lowering mother and infant mortality rates.